Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. As monkeypox cases continue to rise throughout the country, members of the LGBTQ plus community continue to face high risk. Joining me to discuss stigma and the social impact the monkeypox virus can have on members of the LGBTQ plus community is Director of Trans Initiatives for Destination Tomorrow, Mimi Shelton. Mimi, thank you so much for joining me.
Hi, thank you so much for having me. I appreciate being here.
Yeah, so now, what was your initial reaction when you saw that monkeypox was being linked to members of the LGBTQ plus community?
Initially, as a person who is both a scholar of LGBTQ history as well as a person who lives as a trans woman, I was afraid. To be honest with you, I I remember watching, I believe it was CNN, a clip. Um, how far back? I think it was June, maybe May. And I distinctly remember them talking about monkeypox, and then the next statement they made, like me talking about what the actual symptoms were, and the next statement they made said something to the effect of, "We're looking and noticing that this virus is being found more among gay men who engage in higher rates or higher or riskier sex practices." And immediately, my mind went straight to the AIDS epidemic of the 1980s, 1990s, and the early 2000s, and looking at the ways in which stigma and scapegoating led to a lack of access for healthcare support and also community support for LGBTQ individuals impacted by the HIV virus, AIDS virus as well. So initially, my thoughts about the linkage between the LGBT community, particularly gay, bisexual, and pansexual men, and orthopox, better known as monkeypox, was essentially here we go again with the labeling, scapegoating, and stigma rather than focusing attention on the medical issue.
Now, do you think that's why there has been a lot of mixed responses, in the LGBTQ plus community when it comes to, outreach regarding monkeypox? Because I know online there are some people who are saying, well, we need to talk about this, and this is something that we need to talk about. However, some people may be afraid, like you said, that this stigma is going to follow them around. So do you think that's why there has been this mixed response?
Absolutely. I think that when you're dealing with sexual identity as well as marginalization around gender identity, we as a community, and I speak for myself and I speak more broadly for the community, not in terms of generalization of personal experiences, but more so when it comes to a community based perception of something. Whenever it comes to sex practices, and disease, it can be a very fearful and triggering conversation for queer people, right? We learn very early on that who we are is disease, who we are is risky, who we are will lead to our own death and violence, and deservedly so, right? So therefore, it can be. I do believe, and I know that a lot of the mixed reviews among community has to do with not wanting to face stigma and not wanting to be labeled and classified as undeserving, as disease, because we all want to be accepted, right? And already we've seen such isolation during the pandemic, particularly around who we classify as a body that is diseased or sick or ill. And now the fact that that generalized discrimination is now falling directly on LGBTQ populations or on a medical issue, not a moral or political issue, is very disheartening. And it does lead to those mixed reviews, yes.
Now, I remember you telling me that you said that you had a friend who unfortunately thought or said to you, like, are we just more sexual than other communities? Can you explain how it's so dangerous that, people from this community internalize, what they're hearing about themselves, and what can be done to stop that?
Yeah, fascinating. Absolutely. So I did end up getting my monkeypox vaccine I want to say a week ago now. And as I was getting it, I was there, as I told you, at Senator Gillibrand's town hall on August 1st. I was there getting my orthopox vaccine, and a friend and we happened to see each other, and one of his initial responses were like, "Are we just more sexual? Like, is it our fault?" And I have to tell him, "Don't believe the hype." And I tell other people, "Don't believe the hype. This virus, while it may be at this moment identified within the gay community and within LGBTQ communities, it does not mean," right? And I'm speaking with my bare minimum amount of scientific knowledge. So I'm sure that scientists who are still working to discover what the actual spread and infection rate of this virus is, right, and where it's found and among whom, I believe that we have to be very cautious about believing the hype that this is a moral issue, right? That we are engaging in higher and more riskier sex practices than our cis heterosexual counterparts. Because I can tell you, we're not just thinking about the typical cis heterosexual man in 2022. It's no different than any other time. We're all engaging in sex practices, or if we're not, we might be in that field that has nothing to do with, right, a random epidemic that has started up. So I think for me, when I think about the dangers, it's internalized hatred. It's the belief that you believe you're deserving of your own victimization, of your own death, of your own lack of access to care, because propaganda mixed with political isolation, mixed with scapegoating, leads us to believe that somehow we are more diseased, we are less worthy, right? And that we're deserving of being classified as such, right? And when we're working to fit in to different groups in society, it can be very difficult and very hard to now have to face another epidemic while already having the stigma and the discrimination of the HIV and AIDS epidemic in the back of our mind, historically speaking.
Now, how should leaders warn marginalized communities without causing misconceptions, about the virus as well as that community?
Yeah, so I think that's really two different ways of warning or educating, I would rather say. One is, I believe that government officials and institutional leaders need to work specifically with community based organizations, CBOs, such as Destination Tomorrow, in order to mediate and have a dialogue with communities within whatever locality you're in. And in mediating, what I mean is we in Destination Tomorrow understand the needs of the Bronx community, right? So we're best suited to be able to educate and make aware the communities that are most impacted by monkeypox, orthopox at this moment. Similarly, in any other locality of New York State or New York City, right, government officials, leaders need to be working with, tapping the shoulder of, and funding community-based organizations who do this work on a daily basis of anti-stigma work, of linking trans and queer people to accessing healthcare, mental health care, right, and the physical health care that they need, while also educating us on why testing and having safer sex practices are so important. So that's one thing. Working with CBOs as a mediatory force to reach out to and touch base with the community. I think the second piece of awareness has to be actually educating ourselves and getting the full facts about what this virus is, how it's contracted, how it spreads, right? Because at the moment, the CDC is doing a subpar job at identifying the spread and the trace of this virus because it has been so easy to scapegoat queer communities because people already believe we're diseased and we often internalize that same belief. Therefore, the first is mediatory forces of CBOs and leaning on them, but the second is get the science before you start classifying and scapegoating. Figure out the infection rate, figure out the spread, right? And if you do need to identify that population, find ways of doing it, right, that aren't so public, such as propaganda sources like media sources.
Do
news
you
sources.
think that do you think the propaganda could be deterring people from seeking help or even getting tested?
Absolutely, because the unfortunate reality of the 21st century is that so many people look to the television for their values and their morals, right? Unfortunately, because if we actually look to living life and reading and investigating our own selves, that'd be one thing. But unfortunately, we live in the 21st century where everyone looks to television, news, media sources, reality television for their values and their morals. So yes, I think that this propaganda absolutely leads to uh, a lack of wanting to get the vaccine. It impacted me, right? I didn't want to get the vaccine because I did not want to be classified as a man who has sex with men, which unfortunately WPATH and other medical services often classify trans women as men who have sex with men, right? And that is not something that I even want to begin to touch or go down. So it took me weeks, even months, to go and decide to get the vaccine and to educate myself because I didn't want that stigma on me because of what I knew was going on in news media. So if that's impacting someone like me, and I say a person who has a lot of fortitude, I can only imagine what it's doing to people who are much more vulnerable emotionally and fearful in terms of and unaware of how important your sexual health and accessing health care around your sexual health is important.
Now, I know your organization does a lot of work with that. Can you quickly let us know how people can stay up to date with Destination Tomorrow?
Absolutely. So you could always follow us on Instagram. That is at Destination Tomorrow 452. You can always follow us on Facebook. That is Destination Tomorrow. Sometimes it's Destination Tomorrow 1, but you can follow us on Destination Tomorrow on our Facebook page, our Twitter, which is Des Tomorrow. And as well, you can visit our website, www.destinationtomorrow.org, for more information. We are a holistic wraparound service agency. We offer case management, funding sources. We offer educational enrichment, which includes job readiness, the high school diploma acquisition, and programs. So come out, see us. We're also, and I want to let everyone know, we have guaranteed appointments right now for the orthopox monkeypox vaccine. Please reach out to us if you need those appointments. Until Friday, August the 12th, even though I know this airs later, we will be offering a mobile unit appointment as well on site. So reach out to us at 646-723-3325 or email any one of us at info@destinationtomorrow.org to find out more information about that.
All right, Mimi, thank you so much for joining me.
You're welcome. Thank you for having me and take care.
We'll be right back with more Open BxRx Tuesday.